And I'm very excited to welcome you all here to this meeting today. I understand yesterday was a great success, so I look forward to hearing more about that, and I know that we've got a really exciting program today. So thank you for joining us. I want to acknowledge Kath from Western Health and the Institute of Hospital Engineers, my colleague Carol and Jeanette, who's been helping to organise the event, and particularly to Western Health for hosting us here in this lovely venue. I'd also like to begin by acknowledging the traditional owners of the land on which we meet, the Wurundjeri people, and recognise their stewardship and custodianship of this land over many generations, and just to think about the lesson that they provide for us in terms of their stewardship of natural resources and the direction that that provides for assuming responsibility ourselves. I'd also like to thank today's sponsor, so Daniel's Health. Thank you very much for the support for this event, for allowing it to go ahead. Now, before I kind of jump into a few other things, some housekeeping things. If we need an emergency exit, we exit this door and we go down the stairs. The toilets are out to our right. And for those of you who are members of the Twitterati, we encourage you to tweet and share via social media some of the conversations that you hear today. So we have a hashtag, which is HESF17, so Healthcare Environmental Sustainability Forum 17. So please use that hashtag, and then we can search for all of the tweets that come out today. Now, I'm going to talk to you a little bit about Climate and Health Alliance just very quickly before we begin, but I guess I just also wanted to say today's an important day, I think, to reflect on where we're at in terms of environmental sustainability and climate change. The US announced today, or yesterday, overnight, that they are withdrawing from the Paris Agreement. So the 1st of June in 2007 is a pretty historic day in the history of the world in terms of our ability and to tackle climate change. So that puts the US with only two other nations, Syria and Nicaragua, who are not participating in this global agreement. Almost 200 other nations are committed to action. The harm is not just born in the US. Well, it will help to continue to fracture their society, constrain their economy, but it has implications for all of us. So I just really encourage you to think about that, and in the work that we're doing and the positive stories that are being generated today, just a reminder, I guess, that we really need to redouble our efforts, and not only in our workplaces but as citizens as well, and to work really hard to hold our democracy accountable and to make sure that ours is a well-functioning democracy and that we don't allow the kind of morally reprehensible positions to be taken by our government that we've seen by the US today. Thank you, mini rant over. So I'm just going to give you a little bit of an insight into some of the work that we've been leading at the Climate and Health Alliance for a national strategy on climate health and wellbeing for Australia, and to consider their citizens' right to health in the context of climate policy. So we've been working to develop a strategy to assist the Australian government in meeting those obligations. Just a little quick insight into CAHA. For those of you who don't know, Climate and Health Alliance, we're a coalition of health groups that have been working together since 2010 to advocate for climate action and to promote steps to reduce the environmental footprint of the sector. Our partner and affiliate is the international NGO Healthcare Without Harm, and one of their major projects on which we partner with them is the Global Green and Healthy Hospitals Network, which my colleague Carol manages the Pacific region of, and we're going to hear from our colleague and global policy lead Scott Slotterback shortly. We have developed this campaign for a national strategy on climate health and wellbeing for Australia under the banner of Our Climate, Our Health, which is actually a global campaign. But this is the way that we are giving expression to it in Australia. We also work with other colleagues in the climate movement and are part of Climate Action Network Australia, organisations that are also working towards climate action here. And we're part of a global movement and a founding member and on the board of Global Climate and Health Alliance. We do, all kinds of things that you would expect an advocacy organisation to do, running events such as this, producing reports, research, briefing papers, advocacy, lobbying, education and capacity building. So I encourage you, if you haven't already visited our website, to go there and have a look at the resources that are there. The background to the campaign for a national strategy on climate health and wellbeing, as I said, is the Paris Agreement, but also one platform is a global survey that we led in 2015, looking at what nations are doing on climate change and health on behalf of the World Federation of Public Health Associations. And what that found was no surprise to us, is that Australia lags behind comparable countries in protecting its citizens from the impacts of global warming. As I said, the Paris Agreement, an important driver. We've undertaken an extensive consultation throughout the sector. 98% of people that we surveyed support a national strategy on climate health and wellbeing. We see that as a roadmap to supporting Australia to accept its responsibilities under the global agreement and help to ensure that citizens in Australia's health is protected from climate change, and provide a framework in which we can report against the Lancet Countdown indicators, which will be an annual report of how nations are doing on climate change and health, published the first report this November and every year subsequently to 2030. So there's a very broad coalition of the willing who are involved in this campaign, and these are the logos of the organisations that are supporting the campaign. We will, on the 22nd of June, launch the framework for the National Strategy in Parliament House, and I'm very pleased to say that in a rather unprecedented display of cooperation, we have representatives from both the Coalition, the ALP and the Greens launching our framework in Parliament House. I won't go, yes, it's very exciting, and I think we need to attribute a lot of the leadership to that to the Minister for Indigenous Health, Minister Ken Wyatt, who's been a cooperative partner. We've been running training. We're also building a network of climate health mentors, so we're encouraging people to meet with their MP and ask them to commit to a national strategy. So we encourage you to get involved in that. This was to be a picture of the postcard that we have, but it doesn't appear to have come up. But there's lots of ways that you can make your voices heard, and I encourage you to visit the website Our Climate, Our Health, where you can support the campaign. You can seek support to meet with your MP, receive updates about campaign events and training, become a donor or volunteer with the campaign. So now I'm pleased to hand over to my colleague Carol Behne, who leads our work as part of the Global Green and Healthy Hospitals Network here in Australia. She coordinates our Sustainable Healthcare program. In that role, she facilitates the expansion of the Global Green and Healthy Hospitals Network and promotes environmentally sustainable healthcare practices. Carol is a former speech pathologist. She has a Masters of Environmental Management. She's worked previously in energy efficiency for low-income households, as well as the green infrastructure industry, encouraging the adoption of green roofs and green walls, and does a fantastic job leading our program at CAHA. Over to you, Carol.
Thank you, Fiona. Hi everyone, it's so fantastic to see so many of you here today. Some familiar faces, some faces I haven't seen, some faces I've seen just via profile picture on email or on GGHH Connect, so thanks everyone for coming. Can you guys up the back hear me okay? Loud and clear? Okay. My voice isn't 100% at the moment, so if I get a bit soft, just let me know and I'll speak up a little bit more. I'd like to start by saying a very big thank you to Kath from Western Health and also Kevin Moon from IHEA, who was another big part of organising this day today but couldn't be here today, as well as Jeanette, a wonderful CAHA volunteer who's helped out a lot, and Peter Cremond, also thank you for your help. Before I get into my presentation, though, I was wondering where everybody was from. So first up, who's from Victoria? Pretty good representation. What about Queensland? Yay! And New South Wales? Oh, pretty good. Tasmania? I knew you were here, so I asked that question. Thank you. Anywhere else?
Canberra.
Oh, cool. Sorry. ACT. Thanks for coming. And then what kind of backgrounds do you come from? So who has a clinical background? Awesome. It's kind of designated sustainability role. Okay. Building and facilities management. I don't know what to speak to me. Hopefully it's okay. What about food services? Environmental services. Cool. Executive. Dope. Who else might I miss? Government. Yay. And anyone else I missed?
Non-clinical.
Oh, sorry. What did?
Non-clinical.
Non-clinical. Okay. And consultancy. Thanks. Welcome, everybody. All important components of sustainability in healthcare. So as Fiona said, I run the Climate and Health Alliance's Sustainable Healthcare Project, and that's largely by coordinating the Global Green and Healthy Hospitals Network here in Australia, as well as New Zealand. And I'm very pleased to say that as of today, I will be sharing this role with Lauren Poulton down the front here. She's just started today. Lauren has a background of over 10 years in environmental sustainability and was the former sustainability officer at Austin Health. So I'm very pleased to have Lauren on the team. So Global Green and Healthy Hospitals is a worldwide network of hospitals, health services, health facilities, health organisations who are all working to reduce their environmental impacts and protect human and environmental health. Its GGHH is based around a framework of 10 interconnected goals that you see up on the screen here, all of which are areas that have impacts on our environment, but also present opportunities for reducing those impacts. At the moment, the network has over 770 members from all around the world that represent over 25,000 hospitals and health centres from America, Africa, South America, Asia. And this is the Pacific region, so this is a list of Australian and New Zealand members. 34 members in total that represent just under 600 hospitals and health services in our region. So if you see your health institution or a health organisation that you're affiliated with up there and you weren't aware that you were part of GGHH, come and let me know because I can tap you into the resources that we provide. Oh yeah. So sometimes this message gets lost when I'm throwing a lot of information at people, but the membership in the network is completely free. It's, as Fiona touched on, GGHH is a program of Healthcare Without Harm, and Climate and Health Alliance, as Healthcare Without Harm's regional partner, coordinate the network here in Australia and New Zealand. So Healthcare Without Harm are an international not-for-profit organisation that are working to reduce the environmental impacts of healthcare all around the world. And the GGHH network itself is made up of people from various backgrounds, like the audience that we have today, everyone from nurses to doctors to environmental services to facility managers, a really big range of people who work in healthcare settings. I'm not sure what's happening with my text. That wasn't the font that I chose, I don't think, but my apologies. My husband will be very annoyed. He gets very antsy about text, so I apologise. So what does GGHH offer? There are, through an online collaboration platform called GGHH Connect, there's discussion forums in each of the 10 GGHH goal areas that I mentioned earlier. And they're places that you can ask questions, share what you're doing, ask for feedback on work that you might be working on. And also that we have a range of sustainability experts that give up some of their time to offer their advice and point you in the direction of particular resources we have available. And thank you, Trevor Thornton is taking part in our panel this afternoon. He's one of our wonderful sustainability experts that we very much appreciate you sharing your knowledge with our members. There's also a few guidance documents that the GGHH team have put together in a few of the goal areas, not all of the goal areas yet, but they're documents that I guess if you're just getting started in a particular area like waste or water, you can have a look and give you a bit of a idea or roadmap to follow, or even if you are already putting initiatives in place for wastewater, buildings and I've just forgotten, chemicals perhaps, then you can go through and find perhaps some extra ideas on what you could implement in your institution. There's also links in there to case studies and other resources that you can draw upon for things like business cases and to find out how others have implemented similar projects. There's also some data management tools. At the moment we've got management tools for waste and energy, and these have been developed by the global team on the one hand to give people who don't already have a tool to measure these things a tool. So it may be in Australia a lot of people already have systems that are recording all their data efficiently, but other places in the world, say Africa or some places in Asia don't have the technology that we have. Another reason we've put these data management tools together is we want to get a global picture of what is happening with environmental impacts in healthcare and what are people doing to reduce those impacts. So by contributing to these by putting your information into these data management tools, what we're hoping to get is regional as well as global indications of what is best practice and what is a benchmark for things like reducing waste and reducing energy use. But it's a work in progress. We will, at the moment we only have them for energy and waste, but we'll look to implement more tools in the future, data management tools in the future. There's also a whole lot of links to other resources, reports from places like Healthcare Without Harm Europe, and the last two, educational webinars and case studies, they are also available to anybody. They're available from the GGHH website, greenhospitals.net. All the ones before that, though, are only available through GGHH Connect. The educational webinars cover a range of topics, and presented by a mix of our sustainability experts as well as some of our members who are sharing some of the work that they're doing. And case studies, we work really closely with our members to help them put together case studies to get the word out there about all the amazing things that you guys are doing. Let's see. So I'll talk about that later. Thinking about case studies, another part of what our role will be as Sustainable Healthcare Project Officer is to find out from you what you're doing and share that with others and promote it to the both wider healthcare community and also